Live from the SABC's Auckland Park studios, welcome to this week's Thursday edition of the Watchdog. My name is Vuyo Mvogo. On the show tonight,
elections are over now. It won't pay us anything to look at other political parties. Our business now is to look at our position.
finally speaks, albeit with a forked tongue. We look at the party's own appraisal of its election performance while rationalizing its handling of subsequent coalition talks. This on the day the EFF again made no bones about its decision to snub the ANC in its time of need.
Here is now a mutation, a variant of serious concern, which is now driving this spike in numbers.
A new COVID-19 super variant has been discovered in the country, as well as in Botswana and Hong Kong, and may just spoil your festive season plans. A South African doctor working abroad offers some free and useful advice.
Stop gender-based violence. Stop gender-based violence. Stop killing us. Stop killing us.
Throughout the internationally observed 16 Days of Activism campaign,
Stop raping us.
SABC News will focus on the plight of women and children as the country continues to grapple with the shadow pandemic. SABC News, independent and impartial.
And that's where we start. South Africans from all walks of life today joined the rest of the world and launched the 16 Days of Activism for No Violence Against Women and Children campaign. South Africa's chosen theme this year is the year of Charlotte Manya-Maxeke, moving from awareness to accountability. Maite Ngwana-Mashawana, the minister in the presidency responsible for issues affecting women, youth and persons with disabilities, says women are less vulnerable to abuse when they are economically empowered.
Ngwane-Mashabane believes women are less vulnerable to abuse when they are economically empowered. However, many women are victimized by their partners when they gain employment. This creates tensions in the home, which often lead to gender-based violence. She has called on communities to join the fight against this scourge.
The better protection we can give to our women is to give them economic access so that they do not have to stay where they don't want to, because they've got nothing else except that. Our president has spoken about financial access for women so that women can get a way to do things themselves, because patriarchy said it's not okay for them to do that.
The incoming Johannesburg mayor also echoed the minister's sentiments.
We have committed so much of our resources as government towards the empowerment of women, but what we forgot to do was empower the man to handle an empowered woman. Patriarchy is something we need to fight systematically as well, and men need to be assisted to transition into a dispensation where women are independent, women are empowered.
Experience has taught Dr. Palazzi that abuse ironically rises during the 16-day period. Mbalenhle Mthethwa, SABC News, Johannesburg.
Well, my first guests for this important conversation are the Director General of the Department of Women, Youth and Persons with Disabilities, and that's Advocate Mikateko Maluleke. She'll be joined a little later by activists Mandisa Kanyile and Sibongile Ndashe. Good evening, DG. Thanks very much for your time. I'm keen to know what the thinking was behind this year's chosen theme, moving from awareness to accountability.
Good evening, Vuyo. I think all of us know that the services in the criminal justice system, in many instances, they are not up to scratch. And it's because of human beings. South Africa is known to have the best of legislation in the whole world. However, the legislation is good on paper. Legislation needs to be implemented. So the implementers, if they do not do what they have to do, they have to account. But also it says everyone is accountable. It's not the criminal justice system only that will end gender-based violence for you, because the criminal justice system comes in after somebody's dead or after somebody has been assaulted. So at home, when children are raised, at school, at work, everywhere. That's why we say labor, civil society organization, private sector, government, faith-based organization, all of us have a responsibility to end gender-based violence.
Let's start then, DG, with the criminal justice system, which you mentioned first. Are we, and I remember us having this conversation the last time you were here, is progress being made at that level to correct the wrongs, the shortcomings, the mistakes, and everything that stand in the way of our criminal justice system performing, the duties that are expected to perform the way they should be performing them?
Yes and no. In some instances, you find that the dockets will get lost, or there are many challenges that happen. But in most instances, the criminal justice system is coming on board. You have heard of people being given how many life sentences? 10 life sentences. People are arrested. People are convicted. There are jewels in the system, and there are those that are culprits. When we talk about accountability, we are saying those that are culprits need to account. I think from the police, you have police that will pursue a matter even when it's not promising, but they will investigate until someone is arrested. We get reports always of sentences that are taking place, and you have prosecutors that are doing a very good job. You have magistrates and judges that are doing a good job. So I think we are coming. However, the criminal justice system doesn't operate on its own. You need victims. You need witnesses. Sometimes people do not want to witness. People go out and make noise, however, not coming to testify. So all of us need to come together and testify. Some hear what has happened, but they keep quiet and not come to assist the criminal justice system to be able to convict. Are there conversations ongoing about perhaps looking at a system that will ensure that there are consequences even for those that may think in other words, who look the other way, instead of assisting, the state law enforcement agencies to, deal with the culprits? Are such conversations even happening? Yes, I think the involvement, and I acknowledge, but sometimes it's made as if it's a bad thing. I always acknowledge that civil society organizations marched to the union building, and the president had them. And there was a summit which led to the development of a declaration that called for the establishment of the council. But in the process, there was a national strategic plan that was developed. So in terms of the national strategic plan, it brings all role players together, civil society organizations, government, and all those civil society organizations communicate with the public, their constituencies in the communities, so that everyone knows that everyone has a responsibility to ensure that gender-based violence ends. So it's not something that you can say you take people to court unless they lie to court. But if somebody sat at home and didn't come forward to say, I've seen that, most of the time you wouldn't even know. But sometimes you end up knowing. And sometimes people say you are afraid to testify because of what the consequences of our testimony. So that's where the criminal justice system comes in, that it needs to protect the witnesses that come forward.
I mean, you will have seen, DG, I mean, last week's, deeply disturbing crime stats, 9,500 rapes in a period of 3 months. And on the day those statistics were made public, I remember the conversation we were having with the panelists that we have, and one of the things that everybody agreed was or remains an issue is that in spite of, the national strategic plan that we have, the positive attitudes of many hard-working people within the judiciary and the rest of the criminal justice system, and in spite of there being demonstrably, like a president who, appears to be listening and taking this issue very seriously, those numbers are telling us that on the ground, the opposite is happening. Society broadly is not sensitized to this, and the relatives you were talking about, whose job it is, because we can't have police, in every household, policing families and ensuring that the things we see happening actually don't happen. What do we do now, given the fact that in spite of all the political will, all these jewels in the system you were talking about, but the numbers are still showing that we are way behind. We are nowhere near where we would want to be. What still needs to be done?
There are two responses to that. One, I'll talk to the municipalities, but one also I'll talk to the criminal justice system itself. With awareness raising for the communities as a department, we don't even have national or provincial or local presence. However, what we are doing, we're working with the Department of Cooperative Governance to mainstream the NSP in the DDMs, district development models, because we're saying if all municipalities have a strategy on the implementation of the NSP, they are closest to the communities, they will be able to raise awareness, they will be able to establish the rapid response mechanisms, so that when there is a challenge, people know where to go to. However, the other issue in terms of rape cases, sometimes you find that the same person rapes many women because of the challenges or the failure of SABC in terms of the forensic evidence. I know that now they're saying they've tried to fast-track that. However, there was a serious case backlog of cases for forensic evidence. If someone is arrested, but the evidence doesn't come, the court end up releasing that person, and that person goes on raping and raping because they've realized that they were arrested, but they were released. So if on the other side, our criminal justice system is on spot, when somebody is arrested, within 3 months they're convicted, people will know. But also the municipalities also have to take responsibility to ensure that gender-based violence in their municipalities is eradicated, but also that communities also are party to addressing that. The other thing, if communities are aware, communities will also contribute. In which sense? There's long grass, where you find that children are raped and killed and thrown in the grass and all those things. Communities can also take responsibility, work with the municipalities to cut, and make sure that every place is clean, but also that there is light. So as a department, we are working with municipalities to train them, but also now that we have new councillors, we have partnered with SALGA so that we can be able to partner with them when they induct the councillors. We'll be training them on the National Strategic Plan on Gender-Based Violence, also on the gender responsive budgeting, planning, monitoring and evaluation. The gender responsive budgeting is critical. In which sense? It says government and everyone else, if you are budgeting, make sure that you mainstream women. If you are procuring, make sure that in your procurement you include women, because as soon as women have money, they will have, as soon as they have economic power, then they will be able to make decisions where they'll be able to protect themselves and protect their children.
Okay, let's bring in Mandisa Kanyile here, as well as Sibongile Ndashe. Mandisa, your interpretation of this year's theme, moving from awareness to accountability. Mandisa, can you hear me? Okay, Sibongile, let me ask you, the same question. What is your interpretation of this theme?
Thank you, Vuyo. Accountability is one of the things that civil society actors have asked for a very long time. And accountability is something that exists at many levels. So one of the first things that we asked for in the 24 demands was that we needed to make sure that people who are making decisions about the national response to gender-based violence are accountable themselves. We have this national strategic plan, we have the pillars, and most of the time when we talk about accountability, we are talking about the criminal justice systems, that the perpetrators of violence must be held accountable. But we are dealing with a situation where authorities make it possible for impunity to thrive. When we say we have a pandemic, we are not being dramatic. We are talking about a country that has got less than 10% rape convictions. Let that sink. Less than 10%, which means that over 90% of rapists go free in this country. So we may have harsh sentences, but we are not able to hold perpetrators of violence accountable. So when this year's theme says, let's move from awareness, we have called this a pandemic, we have called this a national crisis, we have called it so many names, but we are not moving closer to accountability. And so this year's theme is about trying to get us there, that now that we are aware that we have a pandemic, how do we hold the state and the perpetrators accountable?
Just from conversations you've been having with like-minded people, as you try to think out of the box, given the fact, as you have just said, that the numbers are pointing us in a different direction, in spite of the promises and pledges that are being made, in spite of the heavy sentences you are saying we still have, as you say, less than 10% conviction rate. What are some of the suggestions that are coming through from the sector as things that perhaps we need to try, new things we need to try, or things we need to, reinforce?
The first thing has often been about funding. How do we fund the response? We have called for low barrier funding because some of us who are in kind of bigger NGOs are able to access donor funding that has got all of these stringent requirements. But many people who are providing response to grassroots level are not able to access those funds. So low barrier funding is something that we need to do. We have been engaged in a conversation with the government since last year when the National Strategic Plan was adopted about the establishment of a council. And now that the bill that will establish this council has been released and people have been invited to comment, there are some glaring omissions. Some of the things that we have said, we have been heard, but the issue of funding remains a big thing. This council does not establish a fund. We had a private sector-led fund that was launched by the president in February, but we still need to have a state-led fund because the right to be free from violence is a right that we have in the Constitution. Of course, we must not let the private sector go scot-free, but we need to have it there. We fought for this council, we fought for a legislative framework because we want to strengthen accountability. We have had things established. We have a national gender machinery with varying degrees of success. We have institutions that are not fit for purpose. And we do need to make sure that whatever it is that we build going forward preempts some of the issues that we have faced in the past. We have had weakened institutions, not only in the gender-based violence sector, but nationwide and in different sectors. The issue of political patronage that has given us people who do not know the first thing about the responses that they are supposed to be commanding is a problem. So we have a national prosecuting authority that has missed the deadline, failed to appeal a decision, State versus Togo, that shocked most of us, that at this day and age, you can have a court in South Africa that says someone who expressly said no to penetrative sex, you have a court who says that that person who said no actually gave tacit consent or implied that, yes, I am consenting without having said no, and proceeding to acquit the person who had been convicted of rape. In a country that has got a problem such as ours, where people are not able to go to court. So when we talk about this accountability and what it is that we will need to do, we'll have to strengthen funding, we have to strengthen our institutions, and we have to strengthen the response. We do have problems with police, the prosecution, the judiciary, the inability to move us from the state where we say there is a problem, but the response does not seem to recognize that this is really a big problem.
Mandisa, do you want to come in on what you think, are the things we need to do going forward, given that we have been talking for years and years. This has become ritual every year around this time. The campaign is launched, it goes on for all these days, and then the next year we repeat the same thing. What from where you sit, from your vantage point, are the things, if we were to change gear, so to speak, what do we need to do now?
Firstly, I'd like to apologize for my load shedding. I know it's not my fault and ESCOM's, but I would have liked a situation where I was interfacing with you in the correct manner. The second thing that I'd like to address, firstly, I'd like to say that Sibongile has raised so many important points, and she speaks for a lot of us in the sector, especially part of the Call to Action Collective, etc. Now, the things that I think we are lacking in, one, I think when 2019, if I'm not mistaken, in November, the Department of Women, as well as First for Women and other stakeholders, launched a 365-day campaign towards ending gender-based violence and femicide. And that was actually one of the 24 demands that were meant to be met. So this was meant to be a collaborative effort between the departments and GCIS to create some kind of sustained campaign. So we were supposed to essentially be bombarded with billboards, see it all over our televisions, et cetera, and have correct messaging around what is rape culture, how do we change behavior around violence, etc., and how do we move ourselves from this wounded society that we are to a society that's moving towards healing, rehabilitation, etc., and so forth. And that went dead in the water so quick when COVID came about. And we really haven't seen a proper resuscitation of that. So one of the things that I think is a low-hanging fruit is that campaign. Because if you remember correctly, when we had the HIV/AIDS pandemic, we bombarded South Africans with that kind of messaging. On every billboard, you'd see, wear a condom, what are the preventative measures for HIV/AIDS, go and get tested, etc., etc. This is even before ARVs became available. And there was a public discourse from school level up to tertiary level. Our televisions, everything was talking about the scourge of HIV/AIDS and treating it as the pandemic that it was. And for the way that gender-based violence has been able to manifest itself in our society, and for us to not give it that kind of attention is quite telling about the political will when it comes to GBV in particular.
Okay.
A second thing that I think is really important is really focusing on behavioral change programs. Us as an organization as Rise Up particularly focus on men, specifically in the alcohol environment, within the tavern space, and we try to, by all means, do behavioral change programs there. But I think that we need to permeate different spaces, right? So, I mean, obviously, alcohol space is not the only space that gender-based violence takes place. I mean, we saw a video this week of a gentleman manhandling a woman out of his vehicle because he had bought her alcohol, etc., and he wanted her to leave. And so the kind of public discourse that we had around that, where people were like, no, this is okay behavior, it's acceptable, because this is not exactly a palatable victim or someone that we think is worthy of our time. Those kind of conversations are important. We need to change the public discourse as to what is violence, what constitutes rape. The fact that the bulk of this country still thinks stouting is not rape, stouting being the removal of a condom without the consent of the other person during sexual intercourse. I mean, the fact that that is something that is still not seen as a rape offense, and people still think, you know, and I've heard this from men who actually say, oh no, I didn't rape her, I just broke her trust, right? So when we can't yet change that discourse, I think we have a really, really far way to go. I genuinely believe that behavioral change is the thing that's going to get us to where we need to go. Okay. I think that government can only go so far, private sector can only go so far, policy can only go so far. But if your next door neighbor believes that it's okay to rape their daughter, then we're not fine. If there is no social consequence to your next door neighbor raping their daughter, then we're not far.
DG, let me bring you in here. I mean, presumably you would know about or where things are with respect to the things that, you know, both Mandisa and Sibongile have raised. If you could please come in and share with us whatever you know about, for example, what happened to that campaign, you know, of billboards dealing with the rape culture, which apparently is low-hanging fruit. What happened to, you know, the low barrier funding that Sibongile was talking about, the glaring omissions in the bill, as well as whether you have any comment also about, you know, institutions that are meant to help us deal with this pandemic, but which, as Sibongile was saying or alleging, are not fit for purpose.
Thank you, Vuyo. I think, first of all, before I respond to all the questions, I want to emphasize again, as I said earlier on, that addressing gender-based violence will take not just the criminal justice system, and I've already said that the criminal justice system is failing us in some instances.
And both Mandisa and Sibongile concur.
Yeah, however, that's where I'm going. That's why I say the criminal justice system is failing us in some instances. However, us as communities, everyone is responsible to end gender-based violence. If you have someone who says, I'll kill her and kill myself, the criminal justice system cannot come in there. I've already indicated that in terms of rape, the forensic evidence, it's a serious problem because there's case backlog and all those. In terms of the NCO and NSP and the collaborative initiatives, those things are looked at. And I would like to agree with what I forgot the name, the second speaker said, that we need to change the mindset of people. And all of us have a responsibility, because you start when the child is still small to educate them. By the time your child is at high school or they commit crime, their mind is already affected. So we all have that responsibility. And the issue of 365 days on addressing gender-based violence, it didn't start with the First for Women. It was launched by Hangana. You remember the late Deputy Minister Hangana? She was the Deputy Minister of COPTA at that time. She launched the 365 days activism. And the 365 days activism doesn't just talk to the banners and the billboards and whatever. It says every department, every government department must implement some activities that would empower women, youth, and persons with disabilities in order to ensure that they move from being victims. They end up being victims, staying in those relationships because they're dependent on those people. But also in terms of the criminal justice system, to ensure that it arrests, prosecute, and convict. But also individuals, everyone is responsible to ensure that they implement a certain action so that we end gender-based violence. So it's about everyone. However, the issue of the billboards and whatever, I always say, and even in government, they know, I always say the Department of Women, Youth, and Persons with Disabilities is treated the same way women are treated out there. It doesn't have a budget, it doesn't have resources, it doesn't have so many things. However, we don't sit and say, because we don't have this, then we're not going to do anything. And also, 365 days, there are activities that are happening. It's just that sometimes they are not being, brought to the media attention. However, 16 days, as far as I'm concerned, it is important. Since 1998, when it was launched, in South Africa, it's 23 years, not 30 years, it's 30 years in the US. In South Africa, since 1998, when the 16 days was launched, the media, everybody's talking about it. People came out, laws were developed because everyone is talking. So it raises awareness. However, as indicated earlier on, that we are saying, now we are aware. Let's now move now to a higher level accountability. Everyone who's responsible, whether to report a case, they have to report. To arrest, they must arrest. To empower women economically, let them empower women. Now we are talking infrastructure, economic reconstruction, recovery, economic reconstruction and recovery program. Which most of the time when the president talks about it, he will say the infrastructure program is worth about $1 trillion. So always we say 40% of that is 400 million. Let's make sure that women benefit from that. So the activity, the 365 activism includes also the economic empowerment, because economic empowerment would also address the crime or abuse of women, because women will be able to walk away.
Advocate Maluleke, she's the Director General in the Department of Women, Youth and Persons with Disabilities, joined by Mandisa Khanyile, who's a Director at Rise Up Against Gender-Based Violence, as well as Sibongile Ndashe, who is the Founder and Executive Director at Initiative for Strategic Litigation in South Africa. Special thanks to all our guests. Of course, we will be interrogating these issues in greater detail over the next couple of weeks as we seek to hold those who have been entrusted with dealing with these issues. We bring them here to come and account for what they have or haven't done. But that's why we're going to leave it for this evening. Up next, we're talking about COVID-19 on the back of what we have been told about today, that a super variant has been discovered in the country. South African doctor working abroad offers some free advice. The Minister of Health and some of the country's leading researchers held a briefing today where they briefed journalists and, of course, members of the health fraternity about this new super variant that has been discovered in the country as well as in Botswana and Hong Kong. Something that may just spoil your festive arrangements. Now, take a listen to a bit of what the minister had to say at that briefing.
We had always hoped that any spike of infection leading to a fourth wave would be in the middle of December at the earliest, or late in December, or even in the coming year in January. But here is now a mutation, a variant of serious concern, which is now driving this spike in numbers. We were very optimistic initially that even as we saw the rise in numbers limited to Gauteng and also largely Tshwane and even some sub-districts, we were hoping that this could be contained, because we thought it's just a cluster of the Delta. But now there's a new variant which has clearly been identified.
The health minister there during that briefing. Now, there is consensus among leading health experts that as things stand, the best way to prevent us the worst that could happen is to doing the basics, the ABCs of dealing with this: washing your hands, wearing a mask, avoiding crowded places, and so on, including, of course, vaccination. That hasn't changed. Let me bring in someone who, Dr. Sangla, who is, of course, working in the United Kingdom. The reason I wanted to bring you in, Sangla, this evening, so as I read, during the week, I was reading a piece, a letter, open letter, by a British doctor who was making this impassioned plea to people, saying, whatever, whatever reservations people may have, he has observed certain things that are just, constant. You look at ICUs, in the United Kingdom and across the world. Right now, on the back of, vaccines, ICUs are full of unvaccinated people, and that is just a fact.
Good evening, Vuyo, and good evening to your viewers. And that letter is quite through. It's important, again, to go back to what you started about the measures that need to be taken, and just to add adequate ventilation on that one as well, because of what the new information is telling us. We are dealing with a new condition. You are not going to open a textbook and find a chapter on coronavirus in the medicine field because it's new. Novel is there for a reason. So we are learning every day. And what that doctor is saying is exactly what we are seeing. I'm seeing that in my setting as well. Vaccination works, vaccination helps, and vaccination is one of the things that will help us get through this. Now, as a country, South Africa, we tend to be reactive. I just want to take you back, Vuyo, to when the pandemic started. We were making noise, restrictions, and no one was listening. By the time the lockdown started, it was a little bit late, but it started. We then started to make noise, procure the vaccines. Again, that started mid-May. That's not a mistake, mid-May, because we had a shipment of AstraZeneca vaccines which were sent back, and there were concerns from other professors, like Prof. Madi was saying, use the vaccines that are available so that you protect the older and people with comorbidities. That didn't happen. Only last week, it was documented here in the UK that starting with AstraZeneca in the beginning has helped the UK be in a different situation than what you're seeing in the EU, because most people were vaccinated early. By the time the Prime Minister procured the other vaccines, the vaccine rollout had already gone ahead. And then we move on to boosters. We are always reactive. The world at the moment is on boosters. South Africa is sitting at 34.8% vaccinated population. Now, we have, again, this tendency of wanting to do studies, but the CDC, the FDA have licensed the use of these vaccines as boosters. We then have, again, new words that we come up with in South Africa called a third dose or a second dose, not a booster. But the rest of the world is saying things differently. Now we get to a variant, which is something that we've been expecting. There's nothing new here. If, as a population, you are not vaccinated, you are not protected, the virus is going to get into the body, replicate, and mutate. That is how it does things. So there's nothing new that's going on here. So we need, as a nation, as you were saying, to be responsible. This is a group assignment. If you are coming in with South Africa at 34.8%, the United Kingdom is coming at 98, Israel is coming at 98, 87, and so forth and so forth. The average, the aggregate is going to be taken, and if we fail, we all fail. You cannot, at this stage, behave as if it's 2019. You've got to change something. The doctor that you referred, sorry.
In fact, I was going to refer back to that doctor's letter, and it was interesting for me how he actually spoke of the things he saw and the things he encountered, the people he met, the people who are filling up the ICUs across the United Kingdom. It's the guy who ate and worked, worked out, the guy who was very healthy, but, never got to make the appointment to go and, get vaccinated. He talks about, the person who saw someone who had a swollen arm or who was experiencing bad side effects after having vaccinated and felt, no, I'm not going there. He mentions, a pregnant lady, who was worried about, the effect taking the vaccine may have on her unborn child. And these are the sorts of people who sound like the guy or the woman next door. These are the sorts of people who are now filling, ICU and occupying ICU beds across the United Kingdoms. And these are the people we know. I can tell you of someone, I know in need or fall, in each of the categories that I've just mentioned.
That is true, and it is something I don't understand, because last year, I think, when we started trying to get people sensitized into making sure that when the vaccines come, they get vaccinated, and this year, I did write a column about vaccination. I started at children, because children get vaccinated early. When you take a child to school, I think you produce a vaccination card. If you are traveling to cover something in Nigeria, you'll go to a travel clinic and you'll get all the necessary shots that the visa process wants of you. But now, I'm not sure how you get to work, but there's a billboard on William Nicol saying, don't vaccinate our kids. Now, that's a parent that paid for that and put that up. But the kids are vaccinated because they need that for school. You need vaccinations because you go to the travel clinic to get the required documentation to get your visa approved. So I don't understand why during a pandemic, we then have an issue with one vaccine. which has been shown the world over to be having an effect. Now, it's not a silver bullet, please. It's not a silver bullet because your colleagues during one briefing allowed someone to say that. It's not a silver bullet. It is one of the things, as you said in your opening, that are going to help us. It needs to be used together with the other measures. But for it to work, we as the citizens have got to do our part. I do watch on the app your channels, and I've seen some doctors there, and I think there's an advert from the Solidarity Fund which has a very good message. Help us get back to where we were. The message is succinct, it's clear. We need to pull up our socks and do our part for yourself, for your family, for your children, for your neighbors, and for the rest of your country. We all need to be there. As I said, this is a group assignment. We need to get over 80% so that we can pass. Now, unfortunately, passing means being alive and not dying.
And that's where we're going to leave it for this evening. Thank you very much for your time, Doc. Let's allow you to get back to work. Dr. Sangla Khosani, who is a South African medical practitioner based in Manchester, England. Now, today, two political parties, the African National Congress and the EFF, made some pronouncements on the back, of the rather interesting things that have been happening over the past week as parties got to negotiate coalition arrangements, some with a great deal of success, but others actually without. And you all saw what actually happened in Gauteng, all the municipalities, Tshwane, Johannesburg, and Ekurhuleni going to the Democratic Alliance. In Nelson Mandela Bay, that one going to an ANC-led coalition. And yesterday, a lot of drama in eThekwini, but eventually that municipality going to the ANC. Well, the ANC, for the first time after postponing their briefing a few times, got to have their say, blaming everything and everyone. Here's Fikile Mbalula a couple of hours ago.
We have declined and we have lost some of the municipalities in the country. We did not do well. But we know as the NEC collectively that it could have been worse than it is now. We know. And what did we do? We put up a spirited campaign, unfortunately did not take us to where we wanted to. Because we know that if we crossed the line, we will not be where we are today. We did not reach our objectives. Now, there are some opportunists, even in the party, who are rebels in the party, who are basically calling for the head of the NEC. They see the opportunity. The ANC, I've explained to you, we have started to evaluate what happened, where we lost, where there are coalitions, how many of our people did not come to the party, in which areas. But I can tell you from where I am. Gauteng and KwaZulu-Natal, that's where the biggest loss came from.
Well, Professor Kialebucha Mopunye is from UNISA's Department of Politics. He joins us now. Prof, you heard what the ANC's head of elections was saying. Is he on the money or is he making excuses again?
I like the way you put it very for
okay. That line.
Nothing here.
Okay, that line is not so great. Let's see if we can improve that line. But take a listen to what the leader of the EFF, Julius Malema, had to say at their briefing a few hours before that ANC one.
The DA owes EFF nothing. We don't owe DA anything. Nothing. We're not going to have a meeting with DA in the next 5 years talking about municipalities, how we can manage municipalities, nothing. We heard Herman saying when they go to negotiations, the EFF will be there. We are not going to any negotiations, Herman. You can go, you speak our language very well. You will represent us. Go sit there.
Julius Malema there at their briefing hours ago, few hours before that ANC one. Professor Mapunye, let's see if we can hear you now. Let's go back to that. What I asked you at the beginning was whether, just from the little, from that clip we played there, whether you thought the ANC's head of elections was on the money in his analysis of what went wrong.
Yes, the reason for your I like the way you're thinking. Blaming everything, everyone. And in my view, nothing could be better than the reality that the party is in apology. Right? Which in my view, it's only like the sort of
that line is really not playing ball. They're sincere apologies there. But of course, the ANC's head of elections also blamed the media for not assisting the ANC in its campaign. Some of them came for very specific mentioning, among them the SABC, saying the SABC decampaigned his organizations, but also saying the IEC did not give them sufficient time to be able to register people and so on. Of course, as everyone knows, every other party that contested this election, had the same amount of time as the ANC, the period within which to campaign. The SABC a short while ago did also issue a statement saying it notes with concern allegations by Minister Fikile Mbalula that the SABC's coverage of local government elections was to blame for the lower turnout and the ANC's poor performance in several municipalities and metro. Minister Mbalula has also personalized the matter by unacceptably, I should say, singling out and criticizing the SABC's Group Executive of News and Current Affairs, Ms. Patiswa Makopeni. The ANC has not submitted any written evidence to substantiate these allegations. SABC management believes the SABC News covered these elections in line with its editorial policies and ICASA regulations. SABC management therefore rejects Minister Mbalula's allegations in the strongest terms. The public broadcaster believes that this scapegoating of SABC News is unacceptable and disrespects the SABC's role as an independent national public broadcaster fulfilling its constitutional duty. It's about time politicians took responsibility for the things that they do or don't do. That's our program for this evening. To join us again tomorrow evening, same time. Good night.